The doctor says patients are growing weak from malnutrition and dehydration. Due to the lack of heating, patients who had pneumonia before the disaster are getting worse and dying. Gas and water are still out of service. 72 patients with the severest symptoms were transferred to another hospital. The chief nurse says patients have been sent out, but that doesn't mean the end by any means. She says they'll have to make another fresh start and move on. Medical services are also lacking in the outlying islands. The tsunami has devastated Oshima, which is part of Kesanuma City in Miyagi Prefecture. Water and power remain unavailable. A doctor voiced concern over conditions at the shelters. He says influenza is spreading, but it's impossible to keep flu patients away from others. He says the lack of water means poor hygiene in the toilets, and he fears more people could fall sick. The island needs gasoline more than anything else. This woman says she has a car, but it's no use. Without gasoline, residents cannot reach the island's hospital. This woman developed pneumonia after the quake and tsunami. The doctor says the woman has cardiac infarction and she cannot survive with her own heart and lungs. In normal times, a woman's family would have driven her to the island's hospital, but without gas, they could only wait for a doctor to visit. At the doctor's urging, the woman was flown on an SDF helicopter to a hospital in Kesanuma. What are the most pressing issues for hospitals in the stricken areas? Our reporter made the rounds to tally their urgent needs. The crew conducted interviews at 255 hospitals. Doctors and nurses said they needed gasoline and water, and they were acutely short of hands. Urgent action is needed, as the patients cannot wait.
NHK has surveyed hospitals with 100 or more beds in the prefectures of Miyagi, Iwate and Fukushima. At least 56 people are believed to have died because they could not receive adequate medical treatment amid the crisis. The situation of medical institutions is serious. This hospital in Ishinomaki, Miyagi Prefecture says about 10 people have died. It cites as a reason that it could not use medical equipment because of a power outage. This hospital, also in Miyagi, says it's lost 2 patients because of a shortage of medical supplies. It also says it cannot examine patients because there's no water. "47% of the hospitals surveyed said they cannot run their facilities as usual. They're handling patients to the best of their ability, but they've had to turn some away. And this is why. The hospital in Iwate says there's a shortage of medical staff. It says some people are falling ill, breaking out with fevers, and not getting enough rest. One hospital in Miyagi says the gasoline shortage is making it impossible for medical staff to commute. It says it's dealing with the situation by working in shifts. It says it will be able to see patients as usual if it gets gasoline. The gas shortage is apparently affecting hospitals. Many hospitals say the power shortage is a problem. This facility says it cannot conduct surgery because there's no electricity and does not know when it will resume. So medical facilities in the devastated areas are struggling.
Ishinomaki City in Miyagi Prefecture sustained extensive damage from the tsunami waves. Many hospitals have stopped functioning and local residents are feeling the squeeze. We look at the immediate needs of the local medical community. Medical facilities in Ishinomaki were hit hard in the earthquake. A quick stroll through the city shows how deep the scars are. There used to be a road here. Using a map as a guide, we head 800 metres inland from the sea to find a hospital. One location, which is supposed to have been the site of an internal medical clinic, has been levelled. The building is gone, and only medicine, masks and other miscellaneous medical supplies are strewn about the wreckage. Walking further through the city, it's possible to see various hospitals that have closed down. The Ishinomaki City Hospital used to be over there, but the site is close to the sea and has been badly damaged. The hub hospital near the sea has shut down. The hospital building is still standing, but a closer look shows that the metal doors are bent in. The 200-bed hospital was the main medical facility for operations and examinations in the community. It was the hospital doctors referred their difficult cases to. But now, it's the central hospital itself that is in need of help. In Ishinomaki, patients rush to the few hospitals that are still functioning. Ishinomaki Red Cross Hospital has about 400 beds. It's the largest hospital in this area. Here's the hospital. Many people are waiting in line since early this morning. There's another line of people who are waiting to get medicine from the pharmacy. The hospital has to use its halls to treat additional patients. There's a shortage of staff because they have to treat 30 to 40% more emergency patients than usual. It has been designated as a key hospital at a time of disaster in this area, but patients who do not have serious conditions also have to come to the hospital because other hospitals are not functioning. It's difficult in this situation to provide highly sophisticated medical care. Dr. Tadashi Ishii says this hospital was supposed to play a key role in the secondary and tertiary emergency care, but the city hospital that was supposed to serve as a primary hospital has been destroyed. He says they're currently having to treat emergency patients as primary cases and also write prescriptions for chronic patients. He says they're overwhelmed by so many patients and it's very difficult to provide sophisticated medical care. This hospital is also functioning as a control centre to dispatch doctors and nurses from other places to local evacuation centres. They came to support healthcare operations in Ishinomaki. The hospital sends doctors to around 300 evacuation centres in and around Ishinomaki. Doctors are worried about the current conditions because they cannot reach people who cannot drive to the hospital. Dr. Ishii says it's currently very difficult for drivers to get gasoline. He says buses and trains are not operating. He says outpatients have to walk to the hospital. He says this is the most serious problem.